Well, with the new year, many people made resolutions, and a lot of them were about their physical well-being. Well, we also need to think about our mental well-being, too. And joining us today, Morgan DeWitt. She's a physician's assistant with Mercy Health St. Rita's in Tell more. And so thanks for joining us today, Morgan.
Thank you for having me. I appreciate it.
Okay, so why is worrying about or making sure we take good care of our mental health so important?
So mental health involves our emotional, psychological, and social well-being. So it affects our relationships with others, how we make choices in life, how we handle stress. So I think focusing on mental health can help you be physically healthy. It can ensure that you have good relationships with other people, make meaningful contributions to your community, to your work, be able to work productively, and realize your full potential in life.
So how do we set then mental health goals? Is it possible to have goals for this?
Absolutely. And I think really too with goals in general, I think the first step is to realize your reason why. Why are you wanting to set these new goals for yourself? Just as if anyone else was focusing on their physical health. We commonly see that in New Year's. Everyone wants to get to the gym, gets that gym membership, but sometimes people forget about their mental health. So we want to make sure that you are making goals that are SMART. So it's an acronym, and it stands for specific, measurable, attainable, relevant, and time-based. And I think too, it's good to break goals into small things. It could be something as easy as telling yourself something positive every day, and make sure you tell yourself that. Give yourself enough time to work on these goals. Don't rush yourself too much, because then sometimes people get overwhelmed and they don't happen at all. And a few examples of good goals for your mental health is to take care of yourself, be kind to your body, make time for mindfulness and kind of relaxation during the day, practice self-love, self-compassion, learn to get help, and whether that be to ask help from family or friends, or even seek therapy or your family doctor or a psychiatrist if it's getting to that point. Learning how to set boundaries, saying yes or no to family and friends, and respecting yourself and your feelings.
Okay, those are some good tips. Also, we're in the middle of winter, and it's cold, and sometimes that could really affect us too, right? And that is seasonal affective disorder. So how do we know if we have that, or how to deal with that?
Yeah, so seasonal affective disorder, they commonly referred to as the winter blues. Basically, it's depression, but what we see is it comes on during fall or winter when it starts to get cold, it starts to get darker earlier, and if you don't treat it, it generally goes away in the spring or summer, when it gets warm, when there's more light throughout the day. So with seasonal affective disorder, basically you have all the symptoms of your typical depression. So you feel depressed, you feel down and sad during the day, you're either sleeping too much or not sleeping at all, eating too much, not eating enough, having trouble with attention and concentration, noticing a change in your weight, losing interest or pleasure in doing things. Sometimes people have thoughts of wanting to harm themselves, feeling worthless, feeling guilty. But sometimes actually with seasonal affective disorder, we see some symptoms that aren't your typical depression. So actually people have carbohydrate cravings, so they're craving more of the junk food, the sweets. They have more weight gain, they're sleeping more. And I guess the prevalence, people are probably wondering who gets it in what can we do to help? It's about 5 to 10% in the primary care setting. It is more prevalent in adults, and they say that it's more common in women, but depression is more common in women in general, so it's not very specific.
All right, so is there anything to do? I know I've heard you can buy lights to set up in your house and things like that.
Yes,
does that help or not?
Yes, it does. So they actually recommend 3 different therapies in general. So the first one is an antidepressant medication. So that's something you could talk to your family doctor. If you do see a psychiatric provider, you can talk to them about. The other is the light therapy. Yes, you can buy them anywhere. You can buy them off Amazon, and they're relatively cheap. The only thing is, if you do get the light specific for SAD or seasonal affective disorder, it has to be 10,000 lux, and that's when it's effective. The other therapy that they recommend is psychotherapy, so talking to a counselor or therapist. Other things people can do, just day-to-day stuff, practice good sleep hygiene, so things such as avoiding blue light before bed, going to sleep and waking up at the same time every day, avoiding caffeine before bed, exercising regularly, having more light in the room, taking daily walks even when it's cloudy out, they recommend as well.
All right, so working on our mental health this year. Thank you very much, Morgan, for these tips.
Yes, thank you.
All right, don't go away. New Edition continues in a moment.
Don't get stuck with internet and TV that costs more and does less.